Hey everybody, welcome to another episode of Rapping with the Rep. I am State Representative Ken Gordon, and I'm here with a very special guest, Steve Walsh, who's the President and CEO of Mass Hospital Association. Welcome back to Rapping with the Rep.
Yeah, thanks, Representative.
Folks, Steve was our very first guest 12 years ago on Rapping with the Rep, and now something like 83 episodes later, he's back in kind of a different capacity. Yeah. Steve was a colleague on the House. He was the chair of healthcare finance when he came here the last time. We did a significant healthcare reform back in 2012, and Steve chaired the committee that did that. So thanks for all those advances to the way that we finance our healthcare. And those challenges have stayed with you for the years since then, as you've been for 8 years, I think, right, at Mass.
Yes,
Mass
8
Hospital.
years. Yeah. Thanks, Rappin. It was good to join you for the inaugural episode, and good to be back now to talk some more about healthcare, which started as a passion for me in the legislature, and now has become a bit of a vocation for me on the outside as I represent hospitals and health systems around the Commonwealth.
Just tell us a little bit about Mass Hospital Association. What does it do? What are your goals?
Yeah, well, our headquarters is right here in Burlington,
just
down the road, District Ave, and we represent all the hospitals in the Commonwealth, and then a number of other post-acute facilities, physician organizations, smaller healthcare organizations, and we really act as a consensus-building agency for anything hospital-related advocacy, legislation, but also clinical, education, communications, just best practices to try to meet the needs of our patients in the communities that all of our hospitals serve.
Yeah, and so the intersection between your work and our work in the legislature has always been close, because our healthcare organizations and agencies have always been challenged here in Massachusetts. And we can work together for that.
You're right, and you and your colleagues have always been so good to hospitals, and frankly, in your care and compassion around healthcare in the Commonwealth. That's why we've led the nation in so many ways for so long, and obviously we're hitting a few speed bumps now, but it's something that has always, I think, been near and dear to the work of the legislature, because the one thing that we all share in common is that we're all patients.
Right.
So when you're hearing from your constituents that are in times of need for them or their families, you want to be able to help them.
Yeah.
You want to make sure we have a strong healthcare system here in the Commonwealth.
Yeah, and I'll tell you, as a person who has been a patient and a person who has been part of the organizations that have addressed our healthcare needs, we are so lucky that people come from all over the world to take advantage of our healthcare system, of our hospitals here, both the research hospitals in Boston and also Leahy, Beth Israel and all, but up and down.
Yeah, they do, and certainly you have a great one right here. I mean, a couple of miles down the road in Beth Israel Leahy Health and the flagship here at Leahy. It's a great hospital, but I think that your constituents that are seeking care now know there are challenges, right? The wait times are longer than they've been. Workforce challenges and other things have created a system that frankly isn't working as well as it once did, and it's incumbent on people like you to ask the hard questions and try to figure out how to make sure that we stay first in the world. Yeah,
and that's a great segue into what I want to talk about here in this program, which is our access to labor in that healthcare industry, and that it's getting frustrated right now. We went to Cuba together with a group of 10 other legislators in the fall, because we looked at their system where they're training a lot of healthcare professionals, particularly primary care physicians and nurses. And it's an area that we need help with.
Yeah, Cuba. I mean, obviously we had a lot of fun, and a lot of laughs, and a lot of fellowship, but we learned a bit. And I think one of the things that we learned there, Cuba is the only country in the world that trains more physicians than it employs. And what a humanitarian opportunity for us to think about as a way to partner to try to bring physicians here when we know we have a primary care provider shortage, or to do some things in partnership, not just with Cuba, but with other countries. And that's why as we enter in and we watch kind of an immigration debate unfolding around us, regardless of your politics, the reality is there are talented workers in other countries that could come here to a place like Boston, where we have the state-of-the-art health systems, and contribute, because we do have a workforce problem here.
Yeah, and that's what we're looking to do in various ways, and trying to get creative. But we don't have to be, as you said, all that creative to identify there's a source of work. There are people who will come into our hospitals and take jobs at the levels that people who are here aren't taking them, or there just aren't enough people here to take them. And so our effort now, our focus now is to look at where can we bring a workforce.
Yeah, whether we bring it, train it, grow the pipeline in some way. I mean, at the end of COVID, as we moved from that stage, which was, not a happy time for us to go back and think about, but one of the things that we did really well was collaborate. I mean, one of the reasons why we were first in the country for preventable loss of life is because of that collaboration among our workforce and people that just cared about making sure that we didn't look like some of the scenes that you saw from other places in the country. But our workforce is tired. And patients are sicker than they've ever been. And at the end of that, we had 25,000 openings. And not just for nurses or RNs or nurse practitioners, physician assistants, every job in the hospital, to your point. Whether you answer the phones, whether you transport a patient, whether you do security, whatever you do, whether you cook, clean, there are openings in our hospitals, and we've done a good job working with members of your team and others to try to reduce that number from 25,000 to 15,000. But we often say in healthcare, we don't have a mattress problem, we have a people problem because we can't staff the number of beds that we currently have.
Yeah, so talk about what are some of the things that we have done to try to address this?
Well, try to drive people back into the profession of healthcare, right? It's a vocation, and we had a campaign called Find Your Place in Healthcare, whatever that looked like, and connecting people back to community. When you think about hospitals from years ago, in any community, the hospital was the largest employer, the largest philanthropic giver, the largest vendor, and they save lives every day. And as we've seen some of our community hospitals struggle, that connection to community has been something that has been eliminated in some places, or at least has been reduced. And so connecting people back to those jobs, going into high schools, talking to vocational schools, starting people young that want to enter this career, and saying that if you start in one door, you can still go into another door. You might start as a nurse assistant, a certified nurse assistant, or you might start as an EMT or in the EMS world, but you can go back to school. You can become an RN, you can become a nurse practitioner, a physician's assistant. There's a whole career in healthcare, and you're really helping people every day. The feeling that our frontline workers get when they leave, knowing that they've made such a difference in the lives of people that they care about, because most people that leave the hospital, they leave out the front door. And they leave in better shape than they came in. And it's really such an admirable profession. And so reconnecting people to the profession, starting to get into our high schools and get younger students interested in healthcare, creating training programs, and helping to fund some of the programs. We've always looked at tuition reimbursement, but we really need scholarship, because sometimes folks don't have the money to start the program. So if we worry about paying it back on the back end, we might have missed an opportunity, some really talented people that could have been great healthcare workers if we just could have got them educated sooner. And so working with Governor Healy on free community college and how we can see if we can get folks that take advantage of that program, then to have a job in one of our hospitals or health systems. There's a lot of different ways. It's not one, there's not a panacea here. There's not one solution, which is oftentimes what makes it the most difficult. However, there's a number of things, and if you push each individual lever, you can make a difference. And as I've said, we've cut that problem about in half. But when your constituents are walking into a hospital and they're waiting, that's often what it is. We just don't have the workforce. And that's really challenging, and that's not going to get any easier as we continue to have an aging population.
Yeah, you're right. Just to one point that you made, I'm really proud to have worked with Middlesex Community College because it's our local community college. And they have the programs available for people who want to get into various levels of healthcare work. And they come out not only with, in many cases, the access to free education or the associate's degree, but also they're well trained and ready for work.
Well, I mean, we have an amazing community college system here. I mean, you're right at Middlesex, and I was privileged to represent the city of Lynn, where we had North Shore Community College, and and I love that school. And you don't have to necessarily come out of school with a significant amount of debt to have a great career. And so if we can drive folks into our community college and have the right training programs, we can fill up our hospital with homegrown talent and people that really care about the mission and care about the communities that they live in. And it makes all the difference. And there really is something different when you're treated by someone who kind of knows your community, understands what makes Burlington, or insert proper name of community here. You want to be treated by people that understand you, that know the community that you come from, that know your neighborhood, and our outcomes for our patients are always better. So when we can really attract people to the field that want to live and work and stay in the Commonwealth, it's great. Now, we'll take all help from the outside that we can in order to fill the voids, but it's really great when we can actually train, educate, and move people into careers in healthcare right here within Massachusetts.
Yeah, and I want to talk about that flip side too, because you're right. There aren't necessarily enough people to fill all those roles from among local people, which is very important. Because we do have people, and we've always had people coming in to our Commonwealth from other areas of the country and the rest of the world to do this. And I know that it's become a challenge. We went to Cuba because it's a challenge, and we were looking for ways to open the door to make it easier for these well-trained healthcare people, including primary care physicians, to find work here. But it's not just that one country. It's all over the world now.
Yeah, I mean, you're so right, Rep. I mean, the reality is this. We have to invest in programs here for a pipeline, but those aren't immediate. Right, someone has to go through school, or we might get folks younger. So to backfill some necessary jobs now to care for your constituents and other communities, we have to be looking other places to get talent here. And if people want to come and we can have them, we should have as few barriers as we possibly can to get folks here. And when you look at some of the potential changes federally, we have a number of folks here that are working in Massachusetts today that their protected status may go away. And we could lose a number of workers. And it's hard enough to get folks here or to train folks here. We certainly don't want to lose any of the talented workers that we currently have.
Yeah, in addition to that, our students are also facing challenges, or feeling like they're facing challenges because of the perception of it, even if today that hasn't reached them. Yeah. We don't want to discourage people.
And I think it's a similar message to our patients. Right? We don't want any chilling effect on patients seeking care. If somebody is sick, if someone isn't feeling well, come and get the care that you need, and we'll take care of you. And there's a lot of, again, other discussions happening all over the country and all over the world. But the reality is here, when you walk through the doors of one of our world-class hospitals in Massachusetts, you'll get treated. And you get treated with dignity and respect, and hopefully we'll be able to identify your problem and make it better. And that's what we're known for. And it's frankly what our hospitals have become so good at. When I look at like the future of healthcare, and we were having all these conversations about the future of healthcare both here and abroad, we get excited about it. You and I get jazzed up about it. And but our workforce in healthcare, their DNA is different. They're used to the doors opening, someone comes in, they fix them, and they send them out. So now we have to ask our entire healthcare ecosystem to think differently. We have to think prospectively about how are we going to change this delivery system so that it works better. Because right now, the number of calls you get from your constituents around their need to get health care or a barrier to get health care, we all know it's not working perfectly well. And we've got to make it better for the people that rely on us for our care. We've got to make it accessible, continue our high quality, and make it affordable. And those are going to be our challenges together to face.
So what are some of the ideas that have been kind of discussed to address these challenges?
Well, when you look at technology, I mean, you really got to be thinking about technology and all of the good uses of it. When you go to visit your primary care provider, whether that's a physician or a nurse practitioner, you want to be doing this. You want a conversation. Yeah. You can do that with AI and not have somebody typing into the electronic medical record. The way the appointments have changed over time, it's really less about that relationship. So getting back to that relationship by using effective technology, mobile integrated health, treating people in their home. If they don't need to be transported to a hospital, let's keep them out. There used to be this thinking, well, geez, you work with a lot of hospitals, you must want everybody in the hospital. It's exactly the opposite. We don't want anyone in the hospital that doesn't need to be there. We want to send mobile integrated health units to your home. We want to be doing hospital at home. We want to be doing remote monitoring. Let's use technology. It's available to us. So let's use it. Let's embrace it and figure out how we can be as innovative as we can in healthcare. That's really the next generation. When you and I visited Cuba, one of the things that was fascinating about it is that there's one doctor in every neighborhood. Yeah. Every 3 square blocks, there's a doctor. And we're almost thinking here, we got to get back to that. The doctor will visit you in the living room again, right?
Yeah.
And we'll send people out to the home as opposed to have people coming in, because the patients that are in a hospital today, they're really sick.
Yeah.
And if we can keep folks out and make sure that when you have an emergency, you're not getting clogged or backed up in the ED, you can get right in, get seen, identify your problem, admit you if necessary, or discharge you home if that's appropriate, and make sure that those wait times are down as low as they possibly can.
Yeah, I thought that was a fascinating situation that you're referring to, which is every few blocks you had a house, a 3-story house, and the 3rd story, the doctor lived there. The first story was the office, and the second story was the nurse.
Yep.
And all hours of the day, 24/7, you could go in there, you could bring your child in there, and you'd be seen. Because the doctor and the nurse aren't paying rent to be there, that's part of the deal. They're available.
Yeah.
And then, like you said, in the afternoon, the doctor was making house calls. And what's really important about that is just nipping a sickness in the bud. If we could at all possibly do that before it gets out of hand, before someone gets really sick and needs the hospital.
Yeah. And it's, when we are open to learning, we can learn a lot. And I think that the takeaway isn't that we want that system. I don't necessarily want a grid system where there's only one doctor and we don't have the world-class hospitals that we have here. We're not trading in that care. But what we can learn from it is to simplify. Right, to simplify back to the basics of making sure that everybody gets a visit to a primary care provider when they need it. And right now, if you have a new resident to your neighborhood and they call and say, hey, Rupp, I'm trying to find a primary care provider, it's going to be a struggle for them.
Yeah.
And that's exactly opposite of how we deliver good quality health care. We catch things early, we get people primary care providers. That, when we talked 10 years ago, that was part of the discussion. Part of what we hoped for that law is that we would identify individuals having a primary care provider that would get them early on issues, and then we would move to more of a value-based system, and we would pay for outcomes and not pay for services. And we're still chasing that dream. And the reality is that's the only thing that's going to fix this broken system over time.
Right. I remember the goal there is keep people healthy.
Yeah.
Treat them when they're sick, for sure, but do what we can to keep them healthy. So your primary care physician is there to recognize things at the outset, or to encourage you to stay healthy by giving you proper advice on things like, nutrition and other things.
Yeah. I mean, nobody ever wakes up in the morning and says, I'm so excited to go to the doctor today.
Right.
Or like I just talked to one of our former colleagues who was coming out of the dentist. Nobody says, I really want to go to the dentist today. But if we get people that mindset, that the primary care visit early, that annual physical, whatever he's doing, that's going to save a lot of challenges later on. But then if they do want to do that, we have to be able to have providers to be able to take them.
Yeah.
And that's where it's incumbent upon us to change this system so that it's more of a primary care focus.
Yeah. And I look at a lot of things from the point of view of our economy. That keeps people healthy. It keeps people going to work. It keeps our economy going. It's better for all of us. It's better when people are treated, because if they have something that may be contagious, they're not spreading that to someone else. So we've learned a lot recently about.
We certainly have, and we're getting better at it. We certainly learned a lot about how to deal with public health emergencies. But you're right. I mean, we often don't think about healthcare as what drives our economy.
Yeah.
But it does. It does from the number of jobs, largest employer in the Commonwealth.
Right.
It does from us being a healthy society where we can contribute more if we are healthy, and the healthier we are, the more affordable our system is. Right? Because we're avoiding those big costs down the line when something is catastrophic. So investing in healthy, outcomes, I mean, that's really where we ought to be putting some of our, dollars if they're there. And when we talk federally about some of these, cuts or whatever is happening federally with Medicaid or Medicare, they're changing the way that we operate our programs. They're talking about it as a healthcare program or as a social service program. And I think it's also important that we talk about it as the national economic engine. I mean, everything in the country is built off Medicaid, everything. Yeah. And so when you start looking at cutting Medicaid, you're really cutting the national economy. And not only does it hurt the health of our constituents, but it hurts our economy. And I think when we look at it that way and we really think it through, whether you're red, blue, or purple, you want to be investing in the health of our country.
Yeah. I imagine that's going to be keeping you up at night, because what drove the system that you put into place 12 years ago, and really prior to that, was when it used to be that people would show up at the hospital, they had no health care coverage at all. They were treated. We treat people. If you have a heart attack and you show up at the hospital, you get treated, but who pays for that at that point? Who's there to pay for it?
Yeah.
We put a system in where we covered, what, 90%, more than 90%?
Yeah, we're at our height, 98% in Massachusetts, yeah.
Yeah, because of that system. And so now there's a payer for that.
Yeah.
If we start to change our Medicare system, our Mass Health system here in Massachusetts, so that people are showing up uncovered again because they don't qualify, who pays for that?
Yeah.
Nothing is free.
Yeah, and I think that's where some of the arguments that maybe get too heated politically are short-sighted. Because you know who pays for it? All your constituents.
That's right.
Because the laws are in place that if somebody walks through the doors of a hospital, we have to treat them.
Yeah.
And not just have to, but want to.
Right.
But we don't turn people away. And we look at it insurance blind. So we don't know when they come in whether they are on GIC or Blue Cross or uninsured or Mass Health. And so part of the concern around some of the changes federally is that there are going to be far more uninsured people. Those uninsured people are still going to be sick. And those sick uninsured people are now, where are they going to go? To the emergency department. And then two things happen. The wait times in emergency departments go up, and that's not comfortable for anybody. And the cost of our care goes up. And we're kind of blessed in Massachusetts where we have a pretty good system of payers and providers that collaborate. And we've got some nonprofit local insurance companies that have been here for years. And we've always had a really good working relationship with them. But this is going to test it. It's going to test it when, and you just saw this week at the Division of Insurance where they were looking at the rate increases among our local insurance companies. And that's only going to get worse if we increase the number of uninsured people. So regardless of our views on the bill, it really isn't economically sound when we push a bunch of people into the uninsured population.
Yeah, and I think it hits our community our community hospitals especially hard because they take so many people who are now dependent on Mass Health, and now how are they going to get paid? How are they going to spread those costs out?
Yeah, and community hospitals have been struggling for years, and I think driving care back into the communities is critical. I mean,
Right.
there just isn't enough capacity, in some of our academic medical centers to take care of everybody. So when we think about it, we really need a good system within the community of community hospitals, of skilled nursing facilities, of nursing homes, and all those things working together is what makes the system go.
Yeah.
And right now, it's not. We're having trouble moving people from the hospital into skilled nursing facilities or into nursing homes. It's taking longer to discharge folks. We've got shortages in our emergency medical services. So just moving people when they're ready to go has become problematic. And so as good as we have been here with collaborating among our EMS workers, our ambulance companies, our insurance companies, our skilled nursing facilities, our hospitals, even with the best of intentions of trying to do the right thing, it's getting slower and slower and more expensive. And those are the things that we've got to figure out what our solutions are going to be. And, as we said a decade ago, and watching your career and the extraordinary work you do for your community in the legislature, I'll bet on us. Right?
Yeah.
You got really talented colleagues. We just have to sit around a table and we've got to figure it out and say, how are we going to continue to keep this the best system in the world? Yeah.
Now, one thing that we've been supporting since you've been there and since I've been there is our life sciences industry, our research. We have the best research hospitals in the world right here, including Leahy. And any challenge we have to funding through the NIH or the NSF, is going to have an effect on us. We've invested a lot of money into life sciences research. We'll continue to do that. It's our strength in our economy, and I know we'll work together to keep it that way.
Yeah, you're so right. I mean, we just have such great companies that have built up here. Local companies that are making life-changing, life-saving therapies.
Yeah.
And I think about some of the incredible work that my colleagues at Mass Bio have done.
Right.
And we really, if other states, they want what we have. They want the life science industry that is doing extraordinary life-saving work every day. They want the hospitals that are the best in the world. They keep people literally flying every day from every part of the country and the world to come to. They want our pediatric hospitals and our cancer facilities. I mean, we've got it all here. And sometimes it's hard. Sometimes there's the old adage around, you treat the people the closest to you the worst. And it always feels like we don't even know how good we have it.
Yeah.
We don't even know how good we have it with our industry here. And we just got to make sure that we're continuing to collaborate and invest in it, because it would really be a shame for the Commonwealth if we were to lose our edge in life sciences and our edge in healthcare.
Yeah, and when you find out how important this is and how lucky we are is when you are touring these facilities and you see that people are there from all over the world coming here to get treated because it's treatment, it's care they don't get where they're coming from.
Yeah.
And for us, it's a car ride away.
Yeah.
For us here in Burlington,
Yeah,
it's a car ride away.
We take it for granted. It's funny. I mean, past Leahy just coming over to visit you.
Yeah.
And I, from the office I sit in, sometimes like a little kid, I can see the helicopter pull in, and you still think how cool that is. But the reality is, there's someone in there that's being flown to have their life saved or to have some life-changing therapy just down the road from you.
Yeah.
I mean, it's remarkable, and you and I have done some foreign travel together, and we've looked at different systems, and you start looking around the world, whether it be in Cuba or in Haiti or in Germany or places that we've tried to learn from, you realize, again, you can always take some best practices. There's always something you can improve upon,
Right.
but we're pretty blessed with what we have just right here down the road.
Yeah, and we are working hard to protect that. It's good
No
that
doubt.
we realize it, but we're also working hard to protect that.
Yeah,
So-
yeah, you're absolutely right, and again, the legislature's been so good at that and such a partner. But you have a lot of challenges. There's a lot on your plate when you look at your priorities as a state representative and representing a community that is very active in the work that you do, and this is one piece of it. But as you have always said in the time you've been there, it's a really important piece and really important to your community.
Right, and in the time that you've been there too, you're familiar with this. People come to us with very legitimate concerns of their financial need. Pockets of people advocating a position for something that needs support. And it's not that it doesn't. It's just that we have a budget and things have to be put into that budget. Things have to fit in. Healthcare is a significant portion of our budget, but an important one because it drives the rest of our economy and the rest of our community, keeping ourselves healthy.
Yeah, I think state representative is like the best job I ever had, and I know you love it. But it's a hard job.
Yeah.
And unlike other states, right, we have a full-time active legislature. A lot of what happens around the country starts here. You and your colleagues come up with a good idea, try to perfect it, send it out around the country. But what that means is you are dealing with a lot of priorities. There's a lot of people that come to you that have really important issues that are important to them. And personally, they're passionate about, and you're trying to pick and choose how you make these really difficult decisions. But when you think about what we produce here in the Commonwealth, right, it's education, it's healthcare, it's life sciences.
Right.
It's what we're really good at, it's what we're really known for, and it's obviously what I think we should continue to invest in.
And it's what drives the rest of our success.
No doubt.
It's primarily when companies come here, when people come here, it's for those industries, and then all the industries that support that industry. It's why we are who we are.
Yeah. It's right, and you're always there when we need you, and I know you've toured our hospitals and you've tried to better understand how they work and what happens in them and how you can better serve your constituents. So I appreciate it because you take really an active, curiosity for what's happening and how you can try to improve it.
Well, I really appreciate that. It's so important. The work that gets done there from a research point of view, from a treatment point of view, is just so important, and that you've been taking the leadership in the advocacy of that is so important because they need a voice, and they've always had a voice in you. From within the building, when you were the chair of healthcare finance, you listened and you learned, and since then, in coming to us to explain the priorities of the industry. So, President Steve Walsh, thank you very much for being our guest on Rappin with the
Always
Rep.
a pleasure. Thank you.
Thank you very much,
Appreciate
folks. Tune in next time. I'm State Representative Ken Gordon, and this has been Rapping with the Rep.